Welcome everyone, and thank you for attending this webinar with FullScript and Dr. Roy Steinbock and Debbie Steinbock. My name is Sarah. I'm part of the marketing team at FullScript, and we are very excited to have Roy and Debbie with us today to discuss the elemental diet in clinical practice. Before we get into the presentation, I just wanted to go through a little housekeeping. So as a reminder, this will be recorded and sent to everybody who registered. So if you have to leave early or would like to watch it again, you will have access directly from your inbox. The recording will also live on FullScript's website, where you can access all of our past and upcoming webinars. And throughout the webinar, if you have any questions, please add them to the questions section, and we will get to them during our Q&A at the end. So with all of that being said, I will pass it over to Dr. Roy to take it away, and I will rejoin you closer to the end of the presentation for our Q&A.
All right, so I'm going to just share my screen here so you can see our presentation. So just give me 1 second. Great. So hopefully you can all see the PowerPoint presentation. And so this is the elemental diet in clinical practice. It's a safe, proven, powerful, yet very underutilized modality diet. And it's interesting because we've been using the elemental diet for quite a long time in our practice. We've known about it for a really long time. We'll talk about that a little bit more. But the elemental diet seems to be something that people are interested in, but have a hard time understanding how to do. And it's so simple, but it does have a lot of details in terms of how to utilize one properly and how to get people through an elemental diet successfully. I think there's so much baggage from the days when the elemental shakes were absolutely horrendously disgusting, and they've become so much dramatically better that now it's easier to get people through an elemental diet with some tips and tricks that we'll talk about.
So we want to debunk a lot of like the preconceived notions of what people think about elemental diets. So let's start by introducing ourselves. My name is Debbie Steinbock. My practice is mindful nutrition. I'm a certified holistic health and nutrition counselor since 2000. I have a personal interest in elemental diets due to my own digestive and health challenges that I had from the time that I was young. And I've been studying, following the research on elemental diets as well as the different shakes on the market for over 20 years now. I work with clients in my practice who have complex digestive concerns such as IBS, SIBO, IBD, autoimmunity, food allergies, and sensitivities. And I live in beautiful Boulder, Colorado with my husband, who you'll meet more in a second, and our 3 children.
And I'm Dr. Roy Steinbock. I'm the founder of Mindful Pediatrics, and I'm a board certified and holistic pediatrician since 1995. And in my practice, I consult with patients on complex and chronic health conditions, especially digestive disorders, immune disorders like autoimmunity, allergies, eczema, asthma, lots of mental health stuff as well, anxiety, depression, OCD, ADHD. And along with Debbie, I'm the co-creator of the Elemental Diet Success Plan program. So before we begin, by viewing this presentation, you agree to the following terms and conditions. The information in this presentation is for educational purposes only and not intended to be a substitution for professional diagnosis and treatment. Please consult your healthcare practitioner before making any healthcare decisions. Our goal in this presentation is to present our knowledge and clinical experience. And for your health and to achieve the best outcomes possible, please consult with your healthcare practitioner before implementing an elemental diet.
So now let's talk about what we're going to cover in today's webinar. So we're going to start by talking about what an elemental diet is and how it works. We're going to go through elemental diet history and the applications of its use. We're going to go through some sometimes confusing elemental diet terminology. We'll talk about the benefits of an elemental diet for a variety of conditions. We'll share with you some of the studies that have been done on elemental diets, as well as a lot of case studies from our personal clinical practice. And lastly, we'll give you a brief overview of our 3-step process for elemental diet success. So let's dive in with the obvious first question, which is, what is an elemental diet? So an elemental diet is a diet of nutritionally complete medical shakes. Basically, what this means is that the powdered nutrients are considered pre-digested, and they're delivered in an easily absorbed and hypoallergenic form. So typically, the powdered nutrients get mixed in with water to make a shake. Elemental formulas contain all the nutrients that humans require broken down into their simplest components, which Roy is going to talk about in a couple minutes. They require minimal digestive effort and are absorbed very rapidly in the upper part of the small intestine. Digestion takes a lot of our body's energy and resources. By giving our body a break from digestion, you free up those resources to be used for healing and repair, which is why an elemental diet is effective for so many different conditions.
So let's talk about the elemental shakes and what they contain. So the first thing is protein. Actually, it's really free-form amino acids for the most part in these shakes. And the second thing would be carbohydrates. So typically they're monosaccharides, glucose, fructose, dextrose, but they can also be glucose polymers like maltodextrin, and sometimes honey or stevia is used. Fats include coconut oil, palm oil, MCT oil, flax oil, and even fish oil. And then there's the additional nutrients that you need, so vitamins, minerals, and electrolytes. So let's talk about the history and applications of elemental diets. In the 1950s, NASA developed elemental shakes for their astronauts to have highly absorbable nutrition while limiting fecal matter, which is pretty important when you're in a tiny little spaceship. In the 1970s, elemental diets began being used for bowel rest diets. And these were for people who were unable to eat, digest, and absorb nutrients from food properly, like people with really severe inflammatory bowel disease, like Crohn's and ulcerative colitis. More recently, elemental diets are being used for a variety of conditions, especially small intestinal bacterial overgrowth, where it's gained a lot of popularity, irritable bowel syndrome, eosinophilic and esophagitis and gastroenteritis, rheumatoid arthritis, cystic fibrosis, rosacea, AIDS, cancer, and even more, which we'll discuss in a little bit. So how does an elemental diet work? Elemental diets are firstly, they're antibacterial. So nutrients are absorbed very high, rapidly and very high up in the small intestine. And after a few days without any food source, the bacteria begin to starve and die. The bacteria are eradicated without the use of any antibiotics or herbs. Secondly, elemental diets are anti-inflammatory. Because the nutrients are already broken down or pre-digested, this harnesses the anti-inflammatory benefits of bowel rest while still feeding and nourishing the person. In addition, many of the amino acids themselves decrease inflammatory cytokines and actually increase anti-inflammatory cytokines. And the low residue hypoallergenic ingredients can decrease gastrointestinal irritation and calm an overactive immune system.
Now let's go through some elemental diet terminology. So first, let's talk about the difference between an elemental and a semi-elemental formula. So in elemental shakes, the proteins in there are fully digested, and that means they're in the form of free-form amino acids only. In your semi-elemental shakes, they include some proteins that are partially digested. So this means that they have some short-chain peptides, such as whey protein isolate or sprouted rice protein isolate. And in addition to that, they will also contain these free-form amino acids. Now, this slide right here shows the breakdown of protein digestion. So as you can see, protein first gets broken down into a polypeptide chain. Then it gets further broken down into those short chain peptides, those dipeptides and tripeptides. And then finally, the most complete digestion of protein is into amino acids. So what's important to remember here is that only amino acids and those short chain peptides, again, the dipeptides and tripeptides, can be absorbed directly across the small intestine lining without requiring digestion, which makes them acceptable ingredients in elemental formulas. So as we said already, the semi-elemental formulas will contain those short chain peptides, whereas an elemental formula will only have the aminos. So how can you tell the difference on a product label? So typically you will look at the line where it says protein. So in this example of an elemental formula, you'll see where there's a double asterisk where it has protein. What that's telling you is there's no whole proteins there. They're actually all in the form of amino acids. Whereas on these semi-elemental formulas, typically, but not always, you will see a number of grams of protein that they have because they have more of those wholer proteins in them. Now, more recent formulas, what I'm starting to see is this formula, for example, looks like it could be a semi-elemental shake where you see the 10 grams of protein. But if you'll notice the triple asterisk after protein, what that shows somewhere else on the label is it says these 10 grams of free-form amino acids these 10 grams of protein are coming from free-form amino acids, which is why I listed it in the semi-elemental category. In the full elemental category.
Okay, so there's a few other ways that these elemental shakes vary as well. So we already talked about protein, so amino acids versus short-chain peptides that Debbie just described. And also carbohydrates can vary. So first of all, you can have lower or higher carbohydrate formulas. If you looked at that page before, one had like less than 1 gram of sugar, and the other had over 6 grams of sugar. So the sugar content can vary, and the sugar type, which I mentioned before, monosaccharides versus glucose polymers, or even things like stevia and honey. In addition, the fats can vary, not only in type, but also some of the shakes have the fats already in the powder, while others, the fats need to be added separately. And that can give you some more variability in how you use it for patients. In addition, the quality of the nutrients can vary. So for example, some of the shakes have methylated B vitamins while others don't. Some contain byproducts of allergens like soy and dairy.
Corn.
Mm-hmm. And others have lots of flavor options while some only have one flavor. And lastly, access isn't available for everybody. So different countries have different formulas. You can't get all of them in every country. And some of them are actually prescription only. So before, Debbie actually discussed what was elemental versus semi-elemental. And not to confuse you, this is elemental versus partial elemental. So she was talking about the content of the shakes, so protein versus amino acids. And here we're actually talking about how to use the shakes. So in an elemental diet, 100% of the nutrients come from the elemental shakes themselves. So this would be the only thing you or your client would be consuming. Whereas in a partial elemental diet, or sometimes it's called a half elemental diet, a portion of the calories will come from the elemental diet shakes, and a portion is going to come from solid foods.
So now we're going to start to go through the benefits of an elemental diet for a variety of different conditions. So we're going to start with the benefits for Crohn's disease and ulcerative colitis, which I believe is where there's been the most research and it's been used the longest amount of time. So it's important to note that elemental diets are a first line of treatment for Crohn's disease in many countries, but not here in the US. Elemental diets have been shown to induce remission in up to 80% of cases that they've been used for. How the elemental diet works for IBD is that it provides bowel rest, as Roy said before. The idea, again, is that you feed the person while you're resting the intestinal mucosa, which in these conditions works to heal ulcerations and decrease bleeding. Elemental shakes provide a passive absorption of nutrients. So again, the pre-digested and easily absorbed nutrients really benefit these malnutrition and maldigestive states. In pediatrics, elemental diets have shown to improve growth and general nutrition when compared to the use of corticosteroids alone. Elemental diets also help decrease inflammation by regulating the pro- and anti-inflammatory cytokines. So the shakes are hypoallergenic and low residue, which allows the immune system to calm down. They also help normalize the microbiome. So as we said already, this early absorption very high up in the small bowel starves non-beneficial microbes, which improves conditions like dysbiosis and SIBO.
And so there's several different ways that we and other people use these elemental diets for inflammatory bowel disease. First off, we'll use a short bowel rest diet, which is typically 3 to 5 days. And this is great if a patient is just at the beginning of a flare, or we need like a little tune-up to just kind of pop them back into a better
catch them early.
Yes, catch them early and get them in a better state. In addition, we'll use it for much deeper healing and bowel rest. And these typically are going to be 2 to 4 weeks, or sometimes even longer. And this just really gives the bowel time to rest and heal, all the things that we already mentioned on our previous slides. And then people actually use them really long-term as well. So you can use them ongoing in a half elemental diet format for 12 or more months. And some of the studies have shown that elemental diets to be as effective as anti-inflammatory drugs used in inflammatory bowel disease, such as prednisone and Cortef, but without the side effects, of course. And several studies in pediatrics Crohn's have demonstrated both the safety and efficacy of elemental diets, even in pediatric populations. Semi-elemental diets a semi-elemental diet is equally or possibly even more effective than an elemental diet for inflammatory bowel disease, especially when it comes to weight gain. So these would be, again, the partial peptides versus the free-form amino acids. And like I mentioned, a half elemental diet was looked at for Crohn's patients, and they were followed for a year, and relapse rates were significantly reduced with the half elemental diet compared to the control group. So really a bunch of different ways to use it, and really backed up with good scientific research as well.
So now we're going to go through a case study in our practice with a client who we used an elemental diet for IBD. So this client is a 42-year-old female. She had ulcerative colitis for 9 years. I met her when she was 6 weeks into her worst flare. She was having loose bowel movements with blood, cramping and pain, and had already lost about 25 pounds. She had been started on oral prednisone, which was somewhat helpful, but her symptoms persisted. She wanted to try a 2-week elemental diet for the added bowel rest that it would provide. 5 days into the elemental diet was the first time in more than 6 weeks that she didn't wake in the middle of the night to use the bathroom. Her inflammatory markers before the elemental diet were significantly elevated. So her CRP, or C-reactive protein, was 24, and as you can see, normal is less than 10. Her fecal calprotectin was 616, and here normal would be less than 50. 2 weeks after the elemental diet, this client was able to eat simple foods. She was tolerating more food and having 1 to 2 form bowel movements a day with 0 pain. Then we did some follow-up blood work. Her CRP at the end of the elemental diet was 3. So again, previously it was 24 and normal is less than 10. At that point, she was weaning off of prednisone. Her fecal calprotectin continued to drop to 21 a few months after the elemental diet when she tested again. And remember, previously this was 616 and normal is less than 50. The last time I spoke to her was about 6 months after the elemental diet, and she was doing great and continuing her healing journey with diet, supplements, and lifestyle practices. We also had some of our clients write down their success story because we don't always have labs to show you, but we wanted you to hear some of their words. So this client said, at 74 years old, I was diagnosed with Crohn's disease. My doctors gave me steroids, which improved my symptoms, but I tried tapering off them twice and my symptoms would return each time. I tried the elemental diet for 2 weeks as a way to really give my digestive tract time to heal. I'm now in the 6th week of a very slow steroid taper and feeling better than I have in months. Also, I feel like I have a recourse of going back on the elemental diet if I get off track and diarrhea returns. But so far, so good, and I feel the elemental diet made all this possible. Another one of our clients said, I have inflammatory bowel disease, ulcerative colitis, on and off for most of my life. By the end of the elemental diet, my diarrhea had stopped, and now 5 months later, I still do not have diarrhea, nor do I have any stomach pain.
Yeah, so pretty impressive.
We're always impressed.
Yeah, every time we look at those slides or think about those patients. Let's talk about the benefits of an elemental diet now for small intestinal bacterial overgrowth, SIBO, or Irritable Bowel Syndrome, IBS. So lots of attention thanks to Dr. Alison Seibecker and Dr. Mark Pimentel. They're the ones who really kind of put this on the map. And while antibiotics and herbs each target certain herbs, in theory,
bacteria.
That's what I meant, certain bacteria, thank you. In theory, all bacteria would respond to starvation, and that was their theory. And this is really a great option, especially for people who have really high gas levels and severe SIBO. On average, we're seeing a 70 part per million reduction in gas with an elemental diet, which is much more.
2 weeks.
In 2 weeks, correct. And this really helps avoid multiple rounds of antibiotics or herbal antimicrobials, especially in really tough to treat cases. So some of the studies, like we mentioned, in 2004, Dr. Mark Pimentel studied the elemental diet using Vivinex, and the treatment of 2 weeks showed an 80% and 3 weeks an 85% effectiveness in eradicating bacterial overgrowth, which was shown by normalization of a lactose breath test. Lactulose, thank you, breath test. And 65% of the people also experienced an improvement in their irritable bowel symptoms. And we know, or we believe, that 70 to 80% of people with IBS also probably have SIBO.
So now we're going to present to you some case studies on using elemental diets for the 3 different gas types that we can test for in our clinical practice. So this first study is for hydrogen SIBO. This was actually the first person I ever used an elemental diet to treat SIBO for. So he was a 30-year-old male. In his initial test, you can see that there's a rise of over 20 parts per million, which would make him positive for hydrogen SIBO at 60 minutes, and he continued to rise to 133 parts per million by 120 minutes, which was the cutoff time that was being used back then in 2017. So he did a second test after he did a low sugar and carbohydrate diet and took 2 rounds of herbs about 4 to 6 weeks each, as well as a 2-week course of rifaximin. And as you can see, his hydrogen levels still remain significantly elevated, so 147 parts per million, and his symptoms persisted, which for this client was loose stools. So at that point, we decided to do an elemental diet. So post-elemental diet, his SIBO was completely eradicated. So his peak hydrogen was down from 147 parts per million to 6 parts per million. So as you can see, that's almost 140 parts per million reduction in hydrogen levels in just a 2-week period. So as Roy said, the average is about 70 parts per million, but we have certainly seen higher than that in some instances. Since 2018, this client has had regular bowel movements and feels significantly better overall. This next study is for methane SIBO, or now called IMO, which stands for Intestinal Methanogen Overgrowth. So this client was a 37-year-old female. She was diagnosed with methane-positive SIBO, or IMO, several years ago, but she was only given rifaximin. So she decided to retest when she learned that her former treatment was incomplete and she still had symptoms, because with methane-positive SIBO or IMO, you would use a combination of rifaximin and another antibiotic, typically metronidazole or neomycin. So this client's main symptoms were bloating, incomplete bowel movements, increasing food fears. She felt sensitive to everything, even herbal treatments, which was why an elemental diet appealed to her. So this was her first test before the elemental diet. And as you can see, she was positive for methane and her peak was 84.81 parts per million. And to be positive, she needed to be greater than 10 at any point in this test. So she was interested in a 3-week elemental diet. And by the time I did my first session with her, she was already on day 2. I added in an herbal formula for IMO that we put in for approximately 2 weeks of her elemental diet because her methane levels were so high. Now, typically we don't use a lot of herbs, or really any herbs, with people on elemental diets, except in some certain cases when there's really high methane SIBO. So while this client was on the elemental diet, her gas and her bloat were greatly diminished, and she reported that her tummy was more relaxed and flat. So after the elemental diet, as you can see, her peak methane went down from 84.81 to 0.58 parts per million. She was experiencing less gas, less bloating, and less belching, and she said that she could eat a normal-sized meal again. She was having bowel movements a few times a day and had a more tolerance to a wider variety of foods. The last time I spoke to her, she was still experiencing some distension that she could visibly see when she looked at her abdomen, but she wasn't having any discomfort anymore. And then this third case study is for hydrogen sulfide, SIBO. So this client is a 34-year-old female. Her biggest complaint was that she couldn't eat out or eat with family or friends because her diet was so restricted. She was avoiding all FODMAPs, soy, dairy, and gluten for over a year at the time that I met her. Her main symptoms were constipation. She would have no bowel movements for up to 4 days, and then diarrhea when she would finally have a bowel movement. She also experienced bloating, gas, reflux, nausea, cramping, and hemorrhoids. And in addition, she felt fatigue, depression, and anxiety very much related to her gastrointestinal symptoms. She did some herbal treatments before the elemental diet, but she wasn't feeling significantly better, which is what prompted us to try an elemental diet. So this is her pre-elemental diet breath test. So she was positive for methane SIBO, and as you can see, she peaked at 100, which is actually the highest that the lab will report. And again, anything over 10 is positive. She was also positive for hydrogen sulfide SIBO, and here she peaked at 10, which I believe is the highest the lab would report. At this time, anything over 5 would have been positive. I believe now anything over 3 is considered positive. During the elemental diet, this client had normal, solid, and easy bowel movements daily. Her gut felt calm, relaxed, and happy. She had die-off on days 6 and 7, which for her meant that she was tired, had headaches, and some loose stool. After the elemental diet, her peak methane was down from 100 parts per million to 1.9 parts per million. Her peak hydrogen sulfide was down from 10 to 2.02 parts per million. And after the elemental diet, she was having bowel movements almost every single day. The last time I spoke to her, she was working through feelings of hypervigilance and hypersensitivity to every minor symptom she feels, which we always say is very common after somebody's been through this. They're very afraid that their symptoms are going to return.
Okay, so now let's talk about the benefits of an elemental diet for a few other conditions. So for celiac disease, one study showed that an elemental diet repaired intestinal damage and reduced inflammation in celiac patients who did not fully respond to a gluten-free diet. So these are really kind of resistant cases, which is not common, but it does happen.
They become refractory in celiac, right?
Exactly, refractory celiac.
Yeah.
And it was hypothesized that this additional healing is due to the elemental diet also treating an underlying case of SIBO, or that the elemental diet provided time and rest for the intestines to heal. In regards to food intolerance, the elemental diet is being used with people who have multiple food intolerances and severe conditions such as eosinophilic esophagitis for healing and symptom relief. One small study in pediatrics showed that 4 children with intractable eosinophilic gastroenteritis, again, these are treatment-resistant patients, displayed resolution of their symptoms after a 2-week elemental diet. And 3 of the 4 children were successfully completed a reintroduction and could return to their normal lifestyle, which is pretty amazing. In our clinical practice, we've seen clients who are able to tolerate more foods after doing an elemental diet, not specifically people with these severe conditions, but just people who can then introduce more foods in general after doing an elemental diet. And others are able to more accurately identify the foods that they didn't tolerate before, or foods that they are not sure if they tolerated. It's really essentially an elimination diet because you're only drinking one thing, which is completely hypoallergenic. So it allows you to see more accurately once you start introducing foods.
And here are some words from some of those clients. I have multiple health issues that combine to leave me sensitive to most foods and in a near constant state of GI distress. After 2 days on the elemental diet, I had 0 GI symptoms for the rest of the program. I can't tell you how many years it's been since that happened. It felt wonderful. After the elemental diet, it was easy for me to discover and eliminate a few other foods that caused me distress. My GI symptoms are 75% better than they were before the elemental diet. And then from another one of our clients, my regular symptoms of indigestion, bloating, and discomfort after meals are now less severe, and I've been able to reintroduce tomato, onion, garlic, and coconut to my diet. After completing the elemental diet was totally worth it in my books, and I'm still reaping the benefits 5 months out.
So another condition that elemental diets are used for is chronic pancreatitis, which is really a painful and very difficult condition to treat. A 12-week elemental diet, low-fat elemental diet specifically, showed significant decrease in pain and improvement in the quality of their lives. For rheumatoid arthritis, a clinical trial found that a 2-week elemental diet was as effective as prednisone at 15 milligrams for rheumatoid arthritis pain and stiffness. It's important to note that the inflammatory markers, the CRP, the ESR, also hemoglobin, joint swelling, only improved on the steroid group. And this study really proposed the question, which I think a lot of natural doctors have thought, integrative and natural doctors have thought for many, many years, is rheumatoid arthritis a disease that starts in the intestine? And in our clinical practice, we've seen people who are not rheumatoid arthritis patients, but just have pain. And we've used an elemental diets for other things, like example, SIBO, who have significant decreased pain or resolution of their pain after an elemental diet.
And you'll hear from them now. So this first client said, I'm 57 and I had been waking up for the last 7-8 years feeling like I'd been hit by a bus. I just thought that had to do with normal aging. Come to find out, it had to do with my gut. Once I completed a 14-day elemental diet, I was waking up completely pain-free. And this next client said, it's been months since the elemental diet and I'm doing great. My spinal injury has not flared up since. Any arthritis I had developed is gone. No pain, no bloating, and I'm happy to report my skin has finally cleared. Oh, and I poop regularly now. You're welcome.
That one's my favorite.
I know. It always is.
Okay, so elemental diets are also used for eczema. A study of children who had treatment-resistant eczema, again, these are the toughest to treat kids. After 30-day elemental diet, the majority of the children showed improvement, and 73% maintained improvement through the 12-month follow-up. So though elemental diets have not been specifically studied for weight management, we've observed a few things. So many practitioners observed clinically that those who are overweight and have gut problems that prompt the use of an elemental diet tend to lose weight while on an elemental diet. And conversely, those who are underweight may put on additional weight, probably because of the easy nutrient absorption, the minimal digestive requirements, the mucosal healing and anti-inflammatory properties of elemental diets. And this makes it a possible use and possible benefits for people, like we mentioned, with pancreatitis, also cystic fibrosis, AIDS, cancer, and in the elderly population.
Here's from one of our clients. I had a sense that I needed to do an extended fast in order to reset and heal my gut, but I was apprehensive as I was underweight, malnourished, and terribly ill. I began a partial elemental diet and then transitioned to a full 2-week full elemental diet. For the first time in over 2 years, I found significant 75% improvement in my GI, energy, and brain fog symptoms. I'm now off the PPI medication, eating more food than ever with more joy, having energy to live more fully, and participating happily again in my daily routine with more peace. I sleep better and have gained weight.
Great. There's some additional benefits that we've observed clinically with elemental diets. So firstly, when people are sick, food often feels really confusing. They'll often ask, what should I eat? And we've seen this a lot in our practice. And an elemental diet can offer a welcome break from this. Without grocery shopping, cooking, cleaning up, people enjoy extra time each day to do other things to take care of themselves. When I did an elemental diet, I actually got to play guitar every day for lunch instead of having to prep food and clean up and all of that, which was great. And any break from our normal diet gives people an opportunity to rest and renew their relationship with food, especially addictive foods like caffeine and sugar. And these diets really appeal to people who don't want to take any medications and or who may be sensitive to herbs, or when SIBO has been resistant to these treatments in the past. So elemental diets are incredibly safe in general, but there are a few conditions that require some caution. Children is a really good example. So, the big issue can be compliance, even though the shakes have gotten dramatically more palatable and there's a lot of flavor options now. It's really tough to convince a 7 or 8-year-old to drink the same thing every single day for 2 weeks. And so you really have to monitor the progress closely. You have to monitor their weight, of course, and the calorie intake. And similarly with pregnancy and nursing, you really have to weigh out the benefit for the mom, has to dramatically weigh out the risk for the child. And an example would be, for example, if a mom had severe inflammatory bowel disease, a Crohn's flare, and she needed to be put on harsh medications like steroids or biologic, certainly an elemental diet would be lesser risk than those medications. But if she had mild SIBO, then you might want to wait until after the pregnancy to start the elemental diet. Diabetics do need to be monitored very closely for blood sugar because they're drinking, only eating one thing, and it can fluctuate their blood sugars. In regards to eating disorders, we've seen that people who've had a past history of eating disorders can really be triggered with any restricted diet. So it might not be a great fit if your client, or if you're not completely resolved with that, or if that feels like it might be triggering. And we believe that it should not be used with anyone who has an active eating disorder. And though elemental diets are not technically approved for tube feeding, there are some doctors and gastroenterologists who feel comfortable using them. And so it'd be best to consult with somebody who has experience using that.
And you're talking about the commercial formulas.
Correct.
Yeah. So there's a few different elemental shake options on FullScript these days. So Physicians Elemental Diet by Integrative Therapeutics, Elemental Nutrition by VitaAid, and Element All by BioClinic Naturals. And what you guys will see when you log into FullScript to search for the elemental shake products is each of these companies has more than one variety of their shake products. And so you're going to want to look at the labels and understand them in the way that Roy and I just explained to you. They vary in terms of the sugar content, the fat content, all those things that we mentioned already.
And in our program, we go into details of how to select a specific shake for
that's
your
right
client.
For your condition.
Exactly. So, since we're all practitioners here, prescribing an elemental diet is not as simple as just doing a SIBO test or having a client who qualifies for an elemental diet and telling them you should do an elemental diet and then sending them a prescription from FullScript to buy the shakes. It really does require a lot of guidance and handholding, and we really present it in 3 different phases. The preparation phase, which Debbie will discuss these a little bit more in detail, the implementation phase, and then the transition phase.
Exactly. And elemental diets have a notoriously, I don't want to say bad reputation, but a very low success rate because a lot of these steps are not implemented. What we always say is it's not as easy as saying, mix this together with some water and drink it X times a day. There's a lot of things that the body goes through when somebody's on an elemental diet that if a client isn't prepared for, they're going to piece on out of there pretty quickly.
Yeah. And what we found, and what I really should say is Debbie found, because Debbie's the nutritionist who walks people through these programs and has really kind of honed this in, is that when you can support someone properly, when you can give them all the information they need to be successful, our rate of success is near 100%.
So high. Yeah. And we've seen just near miraculous results. Okay. So the 3 phases that we talk about, the first is the preparation phase. So the preparation phase is something that we start 1 to 2 weeks before we put somebody onto an elemental diet. And for us, this would include things such as doing a prep diet, helping someone calculate their calories and really customizing them to their body's specific needs, helping them order their shakes and any additional supplies, and really educating them about the changes that they may encounter. Roy and I call these par for the course challenges of the elemental diets, things that almost everyone endures when they're on an elemental diet. But if you know to expect it and you know how to prepare for it, it's not going to freak you out as if it just kind of comes on. The second phase is the implementation phase. And this is implementing an elemental diet generally for 2 weeks or longer, as we talked about already. So again, during this phase, clients generally need support troubleshooting their symptoms, answering any questions, just giving them that ongoing support for symptoms. And then lastly, there's the transition phase. And the transition phase can last anywhere from 1 to 3 weeks after the elemental diet. Typically, we encourage people to go onto some sort of a transition diet before they go fully back on to their normal and regular foods.
Great. So here's sort of a list of studies and resources that we've used to educate ourselves. And there's a lot, as you can see, on inflammatory bowel disease, a little continued. One study specifically on small intestinal bacterial overgrowth, celiac, food intolerance, rheumatoid arthritis, pancreatitis, cystic fibrosis, and eczema. And yeah, we want to really thank you. I'm Dr. Roy Steinbock. This is Debbie Steinbock, and we want to really thank you for joining us.
So if you're interested in finding us, you can find us at our website, which is Mindful Medicine. And if you're interested in looking more into our program, you can find that through our website. It's called the Elemental Diet Success Plan. And for FullScript clinicians, we're offering a $50 savings if you wanted to take our program by entering the code FullScript. And you can share a little bit about our program. It's basically, walks people through an elemental diet. Well, it's not geared necessarily for clinicians. We've had a lot of clinicians who have taken our program so that they can educate themselves about what their clients will go through or how to do elemental diets within their own clinical practice.
Yeah, I mean, short of doing an elemental diet yourself and going through the program yourself, which is kind of what we did when we started, it's a really great resource to understand what your clients can expect, how to guide them properly. And it's a great resource to have for your clients, because not everybody's going to want to become an expert on guiding people through an elemental diet. Not everybody's married to one who's an expert through guiding people through elemental diets. So yeah, it's a great resource. And we have lots of people sharing that with their clients already.
Exactly. Yeah, thank you for being here with us today.
All right. And we'll send out unless you write it down already, we'll also send out the code in a follow-up email. All right.
Perfect. Thank you so much, Roy and Debbie. We had a lot of good questions come through, so we will try and get to as many as we can right now. The first one is, if you follow an elemental diet, does this mean you utilize the medical shakes to meet all nutrient and calorie needs and eliminate all additional nutrition, for example, solid foods?
Yeah, so what you just described is a full elemental diet. So, as we said there, you could do a partial elemental diet for certain conditions or with certain people, or a full elemental diet. But yes, you would basically put aside all solid food.
Great, thank you. Is there such a thing as gluten-free elemental diet, or are they always gluten-free?
They are always gluten-free.
They're all gluten-free.
Yeah.
Perfect.
They're almost virtually completely hypoallergenic.
Wonderful. What about using the Master Cleanse as a similar idea?
The Master Cleanse,
The Master Cleanse is like
the lemon juice and cayenne.
I mean, I think it's two completely different things.
Yeah, you don't get calories in that.
You don't get calories, and also you probably have fermentable fiber. Potentially, I'd have to think about that, but fermentable fiber in that.
I mean, many clients with these severe GI conditions are really struggling being underweight, that you really couldn't put somebody like that on any type of Master Cleanse or fast, or even a broth fast, where they just simply will not have enough calories and they're really going to wither away and potentially go into more of a catabolic state.
Right.
The next question is, could an elemental diet be introduced or recommended for a short period of time if a patient is recommended to be on an anti-inflammatory diet?
Yes. We definitely use that. So again, we presented the other inflammatory conditions like rheumatoid arthritis, pancreatitis, eczema. Absolutely. And, some people vary in terms of how long they're willing to do it. The studies are somewhat limited, so the exact duration of what someone needs isn't known. We do know that 2 weeks seems to be a little bit of a magic number for a lot of people. And for example, in the eczema study, that worked really well. In the rheumatoid arthritis studies, that worked well. But some conditions require a lot longer treatments depending on the degree of inflammation.
And one of the ways that I've been using elemental diets in our clinical practice, and we go through this and teach this in our course, is what we call elemental diet resets. So typically people who have been through an elemental diet and have gotten benefit from it may choose to do an abridged version of that for X amount of time to get these, small resets in to keep inflammation down, keep bacterial populations down, et cetera, et cetera. So there's a lot of different uses. We kind of only touch the surface of them.
Yeah, and even if we don't get to completely follow up with some of those patients, we do see that they're actually buying more shake off of FullScript occasionally, and so they must be using them for that purpose.
Great. The next question is, what can you use for constipation other than magnesium during the elemental diet with SIBO patients? Regular bowel movements at 1 to 2 times per day, but now not regular and using magnesium.
Yeah, typically that is what we would use for constipation when on an elemental diet. And this is a bit of a bigger discussion, but oftentimes on the elemental diet for constipated clients, the bowels, there will be very infrequent bowel movements, but that doesn't mean that they're constipated. The elemental shakes will just produce very little fecal matter for some people. But if you actually ask them to report their sensations, their gut feels calm. They don't feel like they have to poop and can't. So for most people, it's not a true constipation. It's just a slowing down of bowel movements or, anything coming out.
Yeah, like we mentioned, they're originally designed for the astronauts who they wanted to have little fecal matter. So most of the stuff is really absorbed. There's very little fecal matter to have. And we talk a lot about poop in our program, but there's lots of varieties of what can happen to people. As long
it goes
as
from here to here with your symptoms.
Yeah, exactly.
Yeah.
Okay, the next one is, due to the antimicrobial effects, how do you support the microbiome, healthy gut bugs through this process?
You don't while you're on the elemental diet, typically. There's some protocols for, say, like inflammatory bowel disease, where some people may take probiotics throughout.
Mhm.
But if we're using it for something like SIBO and it's a short-term use for 2 weeks, we don't support the microbiome or probiotic bacteria during the elemental diet. You would come in and individualize that for your clients afterwards, based on their condition, how they've done with probiotics in the past.
Yeah, Debbie and I always joke we're elemental diet purists. The studies have really shown just using the shakes by themselves with not a lot of other things. We've kind of added a few little things, but very minimally, and generally we try to just leave it for the elemental diets.
The next question is, what elemental shake products do you recommend for GI conditions?
I mean, all of the, do you want to just minimize that?
Sure.
Sorry, something just popped up in front of our view.
Yeah, we'll give our website, we'll put it up again.
Yeah. So which products do you, so they're all, all elemental shakes are generally formulated for GI conditions. It just kind of depends on which one we're talking about. So, in terms of SIBO, something like a full elemental product, just aminos, is generally what we would go for. Whereas with inflammatory bowel disease, we may do semi-elemental, we may do a full elemental, really depending on how the client presents.
And the main reason why we use the full elemental or amino acid formulas for SIBO is because that's what's been studied successfully, and also where we have the largest amount of our personal experience in our practices.
Mm-hmm.
Is there concern that good bacteria will die off with harmful bacteria? How is that addressed?
So that is definitely a concern.
And probably a reality.
But it's just numbers,
Right.
So
yeah. I mean, I think the goal is to, yes, I think it does decrease. We've not had enough people who have done like stool tests and SIBO tests at the same time to really know. And I don't think it's been really verified or studied heavily. But of course, it makes sense. If you're starving bacteria, it's going to starve bacteria, not specifically or magically just the bad ones. But it seems like it tends to work out in the end, because people seem to feel a lot better once you eradicate the pathogenic bacteria. And it's more also that it's an overgrowth of bacteria. It's not so much that it's a pathogenic infection, SIBO specifically, but it's more of an overgrowth. And in some of the Crohn's studies, they showed that it did decrease bacterial populations in the colon. So they did show that. They didn't talk about specifics, but just having a lower bacterial population seemed to improve inflammatory bowel disease.
And when we're talking about the colon, we're talking about bacteria in the trillions. So, a
Right.
few weeks of an elemental diet is not going to wipe that out by starvation.
Right.
I have a client who experiences extreme fatigue only after her lunch meal. Could an elemental shake be used during lunch while solid foods at other meals?
For fatigue, well, I think it would, my feeling is I think it would depend on how this person responded to the elemental shake, because they are absorbed so quickly that I don't know if that would sustain somebody that had fatigue. So, we really talk with our clients and on our program about how to drink the shakes and modulate their calories throughout the day so that they have more consistent energy. So I wouldn't say it would be my go-to for fatigue.
I would agree. In
Yeah.
addition, I think, because some of the formulas actually have a decent amount of sugar in them, some have less, and that could really depend on how that person reacts to the sugar. They could be having like a postprandial hypoglycemia or something that's affecting their blood sugar that's causing that.
Yeah.
And it could be also related more to stress at work, cortisol levels, things like that would be kind of the angle I would probably aim at first before going specifically to hypoallergy, to the elemental diet.
shakes.
Mm-hmm.
Great. The next question is, can you address the use of the elemental diet in mental health?
Has it been studied for that?
I don't think it's been specifically studied, but it's funny, while we were lecturing on this, I was thinking it really should be. I see.
Because we think there's a connection between the microbiome and mental
Right.
health.
and inflammation and mental health. I see a lot of patients for mental health issues. It's a big part of my practice. And a lot of them have inflammatory disorders that are leading to that. I would say, a common thing that I'll see is someone come in with celiac and mental health be their first symptom that really like anxiety and depression or OCD can be the first symptoms that they say that we have with no digestive disorder. So I see a lot of pandas in my practice and pans, and those kids definitely have autoimmune inflammatory disorders. again, I think it's a tough sell on the kid side, but if someone was having something certainly acute, if there was an acute onset, a huge change in mental health, then that would be somewhere I really would seriously think about trying it. Certainly maybe before getting on meds, if it was, subacute enough and not severe enough to be safe.
The next question is, can you discuss the risks of an elemental diet in a diabetic patient?
Yeah, so I mean, the main thing would be just to follow blood sugars. It's not specifically contraindicated. You can do it. You just have to know that person needs to be able to know how to follow their own blood sugars very carefully, and you'd have to guide them, and you might have to pull them off if they can't get stable enough blood sugars. We go over this in our program in detail, but we do recommend drinking the shakes, like Debbie said, frequently throughout the day, more frequently.
But not mainlining them all day.
No, of course not. Yeah. But so the increased frequency might keep their blood sugar stable. I think it really depends on the person's physiology and reaction to the shakes. And then different shakes might react different ways. Some of the shakes are really high sugar, which I probably would avoid, things like that.
Yeah, and just one thing to say about the contraindications is most of those, if the client has enough support, they can get around the contraindication. So like Roy said, for a diabetic, really checking in on their blood glucose levels. I just did an elemental diet with a client who had a past history of eating disorders, and we made sure, a recent past history, but we made sure that she was supported by her therapist 2 times a week, as well as checking in with me, while she did it. So for SIBO.
If there is die-off, should you incorporate binders to address it?
You can't. They're fiber, they're prebiotics, they're fermentable. So they would be non-elemental.
Do you have any experience with elemental diets and mast cell activation syndrome?
So not specifically. The studies were done on eosinophilic esophagitis, which is not exactly the same as mast cell activation syndrome, but is sort of in the same family of disorders, I would at least argue. So I think it could be useful. As far as we know, there isn't any specific studies, and we've not had any really specific cases that we've used it with. So we don't really know. I could see it being useful, and I think once you become really comfortable utilizing and prescribing an elemental diet for a patient, you'll see how it's just worth trying for some people. If someone's really suffering, they've tried a ton of different things, an elemental diet's a great way to go, because if you can successfully get them through it, which like we said, we can, it's kind of a relatively painless approach, and there's not really any significant side effects besides some of the transitions people will go through on an elemental diet, some die-off, some stool stuff, things like that we discuss. But it seems like a really safe intervention to try if you're stuck with a patient. Would you agree?
Mm-hmm.
Yeah.
Thank you. The next question is, has this been beneficial for someone with Barrett's esophagus?
So we've used it more for eosinophilic esophagitis.
Yeah, and I think there's some information about reflux specifically, but not Barrett's esophagitis. Again, I think as long as a person's not already having like cancerous change, and this is more of an urgent issue, I think it would be worthwhile trying. And they would need to obviously get a repeat endoscopy, which wouldn't be that pleasant. But I think it's worth trying. We know it's good for inflammation, and Barrett's esophagitis is actually instigated or started because of inflammation in the esophagus.
The next question is, do you use something to disrupt biofilms along with this treatment?
So as Roy said already, we call ourselves elemental diet purists, and we've really come about that because I've been contacted personally by people who clinicians have put them on an elemental diet with using binders and anti-inflammatory thinking like, well, let's just maximize the benefit by giving them all these good things while they're on the elemental diet. And it generally doesn't work out very well. So, we really stick to the way it's done in the research, which is really just using the elemental shakes and supporting people through the ups and downs of what their body goes through in that process.
Because it's also so effective. I mean, we haven't found the need for it either. And your tummy can be really sensitive, like your digestion's really sensitive when you don't have any food in it.
Yeah.
Great. The next question is, where can we find specific protocols for elemental diets?
The only ones we know is our program.
Yeah.
I mean, we literally created our program after we've had success with hundreds of people. And, not everybody can work with a clinician one-on-one. So we did this to start to put this education out there.
Yeah. I'm not aware of any other specific programs or protocols.
Do you ever use elemental diets for reproductive disorders like PCOS that may be closely tied to gut health?
So again, that's not something that's ever been studied. And I think it would be, about like when in the phase someone would try it. So meaning that, we are always advocates of using a balanced, whole foods, anti-inflammatory diet first. It's not like we meet a client and we're like, let's get them on an elemental diet.
Yeah, it's not our first go-to.
It's not a first line treatment by any means.
Not for almost anybody.
Yeah, exactly. Maybe for somebody newly diagnosed with inflammatory bowel disease or something like that, who doesn't want to go on biologics. But, generally with most conditions and hormonal imbalances, we're really trying to support the body first through all like the lifestyle and diet interventions that are available to us. And then we will go to this with more of those recalcitrant cases where you're just not getting at gut health or hormonal balance in other ways.
What type tastes the best, and what do patients report about the taste?
Subjective.
Very subjective. We've done taste tests.
We bring our friends over.
Our friends are crazy enough; they'll do
it.
We've done it, and it's really inconsistent. Debbie and I eat the same food every day. We have the same taste in food, and we didn't even like the same shakes.
To me, one of the new formulas that came out that was chocolate. I thought it tasted like chocolate coated vomit. My sister has it every single day. She loves it so much. It's all over the place. There's some formulas that I'll have a client tell me they taste like a pina colada, and somebody else will tell me it tastes like
cake batter.
Cake batter.
That's the big one.
Exactly. Right. So it's taste is subjective.
It's
is what we've
really
learned.
Subjective, and also we've learned that it really changes throughout the elemental diet. Like it tastes different the first day than it does the 14th day.
Yeah, we tell this story often, but when we did an elemental diet together several years ago, Roy was at work, I was working from home, and we both almost dropped out on day one. Yeah. I was like, I can't drink something this sweet all the time, and by the end I was like, this isn't that sweet anymore.
Yeah. You start looking forward to it if it's the only thing you're eating at some point.
Yeah, you like the chunks in it.
Just like cake batter. But I do like potatoes a lot.
I love it. We have another question. When I first started the elemental diet, I was severely nauseous, and it took several days to get used to it. Do you know why this happened? I was prescribed ED for microscopic colitis.
So, the truth is some people just have a harder time with it than other people. So Roy felt great the entire time he was on the elemental diet. I felt great the first 3 days, which I always tell people was amazing because it really gave me confidence in the shake product, so that when I didn't feel good, I was like, well, I'm not allergic to any of this. That wouldn't just kick in on day 5, And what I see with clients and what we've had people report in our program is like, for some people, it is like a gut vacation from the get-go. For other people, one of the things we address in our program is what we call the 3-day hump, which for some people, it really takes 3 days of just like trial and error and figuring out what you're going to do. And we kind of teach people how to troubleshoot that until they kind of find somewhere where they can just coast, and do it, for the duration.
There's a lot of like psychological preparation it takes, and it varies dramatically from person to person. Generally people who are super healthy and thriving are not doing an elemental diet. It's usually someone who's been struggling for a long time, someone who has something relatively severe and is really suffering. So there's a lot of emotion wrapped up in our wellness and our health, particularly our guts. And yeah, it's hard not to just get triggered by every change, and you're going to feel different. You're not eating solid food. You're only drinking your nutrients. And so you do feel different. Even though I felt great, it wasn't how I normally felt.
Perfect. Well, thank you so much, Roy and Debbie. We really appreciate your time today and all the wonderful information. As a reminder, we will be sending out a recording of today's presentation along with that promo code if you guys are interested in the course. And everyone have a wonderful rest of your day. Thank you again.
Thanks for having us.